Alright, so for the next types of agglutination reaction, we are looking at the passive agglutination test, then reverse passive agglutination test. Alright, passive agglutination test, reverse passive agglutination test. So for this one, we're saying they actually was specialized tests, right? So they are using what? Immunology and microbiology. Alright, so agglutination test, most of the times you are doing it because you want to dictate what presence of antibodies and antigens. You understand? So we have looked at the overview. This one we're just trying to look at what the possible types that we could have. So for the passive agglutination, we said that this method involves coating an antigen onto a carrier particle such as latex beads or red blood cells. Okay, so when mixed with a sample containing the corresponding antibodies, it will now clump, it will now agglutinate. You understand? So when it clumps, it indicates that there's what? There's a positive reaction. That means what? Antibodies there correspond. Now it's commonly used for dictating what? Antibodies in diseases like all those rheumatoid arthritis, different types of viral infections. Right? Then we have the reverse passive agglutination test. So what is a reverse passive agglutination test? Now this one, in this variation, the antibodies attach to the carrier particle instead of the antigen. Here we said that what? It is attached to the antigen, like it's coating an antigen onto a carrier particle, but this one what is coated directly to the carrier particle. You understand? So when the sample contains a target antigen, agglutination occurs. Alright, so this method is useful for dictating bacterial toxins and some specific pathogens in clinical diagnostics. Alright, so okay, you see this is the reverse, this is the normal passive. Alright, so guys, that's just it for these two types of agglutination reaction. Let's move to the next one, which is plate, tube, and the slide type of agglutination reaction.